It's a morning of powerful songs. That's in Nyam right there. This is Sunny 88.7 FM. This one, I want to ask you. I mean, imagine this an accident happens right in front of you at home, on the road, even at work. And those few critical moments, what you do can make a difference between life and death. And that's why this morning we are joined by Dr. Joyce Emefa Klah Addo and Addo-Klah. Yes, let me put that right. And she'll be touching on first aid and emergency response that we all need to know, from handling burns to choking somebody suffering a heart attack. So I'd like to encourage you to stay with us. This could be knowledge that helps you save a life. Her able assistant this morning is my own co-host, Ajimai Opon Pepra. She's brought in her little doll, so she'll be taking us through some practicals. We're live on Facebook. You can join in on YouTube. We are also on our app, Sunny TV GH app. So, Doc, thank you very much for accepting to join us. When the call came in for you to speak to us about first aid, I mean, did you think was something that was really important? I mean, how did you feel when the call came through?
Thank you, Ajma and GGD, and I'm
you.
excited to
Thank
be
you.
in the studio this morning.
Can you
Yes,
get closer to the
absolutely.
microphone? Yes, let's adjust a little bit for you. Okay.
Thank you so much, Ajma and GGD, for having me. Yes, when you told me about the topic, I thought it was very interesting because we find ourselves in a part of our world where when emergencies happen, people don't know, have the technical know-how. Even the basic things to do to sustain life, people don't know. You'd rather find people pouring water on
Yeah.
people in the marketplace, and in the end they end up killing them instead because they end up drowning their lungs instead. So these basic things, out there in the developed world, even kids are taught how to do these things because in the event that you are home and an accident happens, accidents don't give notice.
Yeah.
So in the event that you're at home, you're in the marketplace, you're at work, and something should happen, there's basic things you can do to sustain life for the first 5 minutes till help arrives is very important.
It's very critical. Ajimai.
Jenny, I remember, I think before this, one of the days we were in the office and we're talking about how usually here in our part of the world, maybe something happened, a person collapses, and immediately people are dragging the person to get up. Maybe somebody's hit by a car and then they just want to bundle the person immediately. Sometimes the way they will hold the person, I think we're discussing in the office why we can't simply let the person lay down, maybe call an ambulance until maybe a health, professional gets there. And so I feel this is so important, Jenny, because a lot of people may have lost their lives or maybe gotten some permanent damages if the right people had gotten to them when maybe it happened. I have a friend who lost their dad through he choked at dinner. He choked at dinner, and so it's an issue you don't even want to bring up at all. I mean, the whole family saw him trying to get a thing out of his throat. And he passed on in front of the whole family. Yeah, it was
That's
just a happy
unfortunate.
family dinner.
That's
And so I think this will be very, very important for all of us this morning.
Yeah. I totally agree with Ajimai. So, Doc, run us through what you're going to be showing us this morning, the life essentials we should know for first aid, and then we take it one step at a time.
Okay.
Assistant, Ajimai, are you ready? Did you ever
ready.
dream of becoming a doctor, or for you was not one of those things?
No, but Jenny, I think I used to be called a disappointed doctor.
Then that's the whole interview to have
Because
with
all
you.
through my mom, my mom thought I should be the doctor.
Uh,
Not knowing my eloquence and everything wasn't meant for that. So it was my big brother who was the most quiet person and stuff. He became a doctor
a doctor.
at the end of the day.
Okay.
Yeah. So yeah, I almost.
Dr.
Almost.
Emefa, behold your assistant.
My pseudo doctor.
Oh yeah.
Well, my aim this morning is very simple. It's not to make you a doctor, but at least what you can do to sustain life till help comes. That is my aim
Exactly.
for both listeners out there and then everyone else in the studio. So this morning I'll be touching on choking. It's rather unfortunate you share that sad story about your friend's dad. So I'll be touching on choking. I'll be touching on heart attack, and then I'll be touching on accidental poisoning, what to do, and then minor things like burns. You think burns are minor, but if you have a burn and you don't handle it well, you have people having burns and they can actually die from burns, right?
Wow.
And then I'll be touching on fever. If you're at home and then a child has a fever, the simple things to do before you can get the child to the hospital.
All right. So we're going to adjust our microphones. I mean, you see our microphones in the shot. If you're online, you're watching us on Facebook right now, or maybe you're on our YouTube. Are we live on TV as well, Ezekiel? Are we live? Okay, all right.
Yes,
So
we
we're
are.
live on Sunny TV as well. If you're at work, you can simply download the Sunny TV GH app, Play Store, App Store. Download it. Get on right now and see what is happening.
Okay. All right. Doctor, we're following your lead.
All right. So I'll start first with the major one, which is a heart attack, because like I said, it can happen to anyone. It can happen in the office. It can happen in the marketplace. So what happens? Typically, someone will tell you, I'm having a chest pain. And the chest pain can radiate to the shoulder, typically the tip of the left shoulder or into the arm. If the person doesn't complain at all and all you know is the person has just collapsed, what do? I advise you to stay calm and collected so that you can get your act together. So do not panic as the rescuer. Just stay calm and collected. So in the event that you find yourself in an office space and a colleague collapses, or you find yourself in a marketplace, a church, and someone collapses, what do? You first assess the scene to see if it's safe. So safety of the scene is very important. You don't need to have anything or any object around that can cause potential harm. So you assess first to see quickly to see if the scene is safe, and then you call the person, you tap the person on the shoulder. If the person is unresponsive, so we'll be demonstrating that in a bit.
Okay.
If the person is unresponsive, you tap the person on the shoulder, maybe Mr. Ajimai, Mr. Ajimai, Mr. Ajimai. The person is unresponsive, then quickly you call for help. So first you assess the scene to see, because safety is important both for the patients and for you as the rescuer. You tap the person on the shoulder, you are so sure that something has happened, then you quickly call for help. Once you call for help, now what do? The quick assessment is to check, is the person breathing? Is the person having a pulse? So breathing, you don't even need to be a doctor to know if someone is breathing or not. Just by the chest rising and then falling, you know the person is breathing. So if the person collapses, or in the event that the person falls down and the person is breathing, and then you check for the pulse. How do you check for the pulse?
Yes.
So just below your jaw. We all know where our jaw is. So for those on TV, those watching us live, you know where your jaw is. So just below your jaw, around the upper part of your neck, you just use your 2 fingers and then press deeply. You can feel a pulsation. Can you feel a pulsation when you
I
do?
can feel
Yes.
mine.
Yes.
I can feel
So that's
mine.
actually your carotid pulse.
Carotid pulse.
Yeah, carotid. CAROTID. Carotid pulse. Yeah.
Okay,
So the
okay.
carotid artery is one of the major arteries that carries blood from the heart to the brain.
Okay.
So if you feel for a pulse, it's very obvious. So if you feel for a pulse and there is a pulse, then what you simply, so there are 3 scenarios. You check for the breathing and then the pulse. So in these 3 instances are what I'm going to demonstrate. So if you check and the person is breathing, that means the chest is rising and falling, and the person has a pulse. You only monitor the patient till the help you've called for arrives.
Okay.
That's the first. So you stay calm and keep monitoring the person till help arrives.
All right.
The second one is if the person has a pulse, but the person is not breathing, meaning the chest is not rising and then falling, you give rescue breaths. So rescue breaths, I know that is what most of you don't like. So that is the mouth to mouth. That is the mouth to mouth. So you feel for the pulse. Oh, the person has a pulse, meaning the heart is still working,
Okay.
but the person is not breathing. So you do the mouth to mouth. So your aim is to give a breath. So breathe in. Ideally, if you have a handkerchief, the teaching now is to cover the person's mouth with a handkerchief, and then you give a breath in 5 to 6 seconds. One breath for every 5 to 6 seconds, and your aim is to do about 10 to 12.
10 to 12.
10 to 12 in a minute.
Okay.
Right? So that is the second instance. So the person has a pulse, but the person is
It's
not
not
breathing.
breathing.
Your aim is to just give the rescue breaths.
Okay.
And then the third one, which is actually what is very life-threatening, is when the person has no pulse and then the person
It's
is not breathing
as well.
Okay.
That is the dangerous one. The person has no pulse. So that's the person has had a cardiac arrest, right? So the person is not breathing. The person has no pulse. So you go through the same motion. You assess for safety of the environment for both you, the rescuer, and then the patient. You tap the person on the shoulder, which we are going to demonstrate in a bit. Mr. Ajimai, Mr. Ajimai, Mr. Ajimai. There's no response. Then you call for help. So as the help is coming, what do? Then immediately you start compression. In the past, the teaching was you check the person's airway, you check the person's breathing, and then you compress, which is the ABC of life. But now the teaching has changed. Immediately you have to go to the life-saving compression. So it's now CAB instead of ABC. So it's compression first, and then you do the airway, and then you do the breathing. And when I say compression, what do we mean?
Breathing.
Compression is simply, so you see, I have a mannequin here which I'm going to be demonstrating.
Please join us. We're live on Facebook, YouTube. Download the app if you haven't, and let's gather these.
I can see a question there already, Crab, but I think we're going to go on.
Right.
All right.
So,
All right.
anyway, I think we can look at it. Daiwal is saying, in assessing for pulse, will both sides of the neck do?
Yes, you have it on either side.
Good.
You have two carotid arteries, so either the left or the right, both work.
Okay.
All right.
Right. So your aim is to check to see if the pulse is palpable. If it's not, then you go ahead to do what you have to do.
Okay.
Right. So in giving the compressions, simple way, when you touch your chest, we all have a bone in the middle of the chest. It's called the breastbone. It's the sternum, but simply put, the breastbone. So for a male, you just imagine, look at the nipples, and then draw an imaginary line across. And then just beneath that line, you see the end of the breastbone. A little to the left, it's believed that is where the heart is. So you use your dominant hand. Your palm, you have the protruding part, which is like the heel of the palm. So if you are right-handed, that is your dominant hand. If you are left-handed, that is your dominant. So the aim is to use your dominant hand on that area I just described, and then you use your non-dominant hand and interlock, and then you just place it on the chest.
Okay.
And then you are going to compress.
Okay.
So compress, you try to keep your elbows straight, and then you compress hard and fast. Don't think of you damaging the person's chest or breaking any bone. No, your aim is to compress hard and fast. And if you look at the literature, it tells you 5 centimeters, so that should be the depth. So hard and fast, so you can go as deep as 5 centimeters.
Wow.
And then you do 30 compressions. So after every 30 compressions, then you give 2 breaths. After every 30 compressions, then you do. But if you are lucky enough and in the office you are more than one person can focus on the compressions. As you're doing, you are counting. So if you are 2 trying to save the patient, 1 can focus on the compression, and the other will just be at the head and doing the mouth to mouth. So you don't do the mouth to mouth. The person is counting 1, 2, 3, 4, 30. Then you breathe 1, 2, and the person will call you, reassess, and then continue. So you keep doing that till help comes. So like I said, your aim is to push hard and fast. Hard and fast. Don't mind you breaking any rib cage or any bone. Just keep going as hard and fast as possible.
Okay.
You can aim at a depth of about 5 centimeters, and you do 30 compressions. And the aim is to do about 100 to 120 compressions in a minute. So hard and fast 30. And we use this theme song typically, Staying Alive. So if you know that song in your mind, it gives you a rhythm by BG. So staying alive, staying alive, staying alive, staying alive, staying alive.
Okay. All right.
So that gives you the rhythm.
Okay.
And you keep doing that. If you're tired, if in about 5 minutes you're tired, and there's someone around, you can exchange with a person. But if it's just you just keep doing that till the help comes. Look, this looks very simple, but it actually is very life-saving.
It's very life-saving.
So in the event that you're in an office and your colleague collapses, panicking, screaming, yes, I know you'll be scared, but keep as calm as possible. And this simple act of what I went through is more than enough to save the person's life till help comes.
Okay.
And like I said, this is just basic life support. So my aim is not to teach you how to give medication, because basic life support is not about giving medication. It's about keeping the person alive till help comes.
Okay.
So staying alive. Staying alive, staying alive. So that should be your motivation. You keep the person alive till help comes. So that is it about cardiac arrest. Please, you don't go pouring water on the person. You don't go slapping the person. You don't go shaking the person. No. The person collapses, check for the safety of the environment, and place the person on the back flat. So you need a flat surface. That is why I initially wanted to use the floor, because in a practical sense, when someone collapses, the person is on the floor. So just clear any harmful object from the environment and keep the person flat on the back, and then you go through all the motions that I taught you. Ajimai, how do you want us to be? I like practicality. So
it's very important.
Do you want us to demonstrate before we move on to the next, which is choking, or you want me to finish everything before we demonstrate?
let's I suggest that we see the practicals.
Yeah, let's demonstrate. Let's demonstrate.
I agree.
And whilst we're at it, Emil is asking, may I know specifically the kind of help I should call for?
Just scream help. It's like in the look when you say Obimboami, like anyone around. So what happens is, calling for help is to get people in your immediate environment to come around, and they can activate an emergency line. So if it means organizing for the person to be gotten into a hospital or organizing an ambulance, that is what we mean by call for help. But whatever be the case, call for help, because you can't be in there. For how long can you keep doing compressions? So call for help. So the next person can be activating the emergency line, calling a hospital, calling an ambulance. So you keep doing that. So you know, in the developed world, as you're doing this, once someone calls, is it 911, ambulance is already on the way. Yeah. So before you know it, there's help. But you call the other person. The aim is to get the person to activate an emergency response whilst you do the basic things to keep the person alive.
Alrighty.
And for us as a country, I mean, this is very essential. I mean, I'm sure you all understand what, when she mentioned the developed world. Okay, I think we're good to go to follow.
Yeah, and Jenny, just a quick one to add to that. Because I'm an advocate, a health advocate, so I'm advocating for AED devices, the automated external defibrillators. These are life-saving, in corporate institutions, in the malls, because these are places where people gather. I find it very amazing when I'm traveling and you get to the airport and at vantage points you have AED devices.
I watched a documentary like that of a country, and it was at vantage points.
Yes, you can be taking a stroll on the street, a building, and you see an AED device. So in the event that someone collapses, there's one around the corner you can use. But the question is, do we have same? So these are the kind of advocacies that I do. Heart attacks, it happens to even doctors. Last year, we lost a colleague of mine. I don't know if you heard that story in Konfanochi, the doctor.
Yes, the doctor.
He actually says that he's an emergency medicine specialist, and we lost him to a heart attack because, so it's actually disheartening. It can happen to anyone. So these basic life, skills actually help. But as an advocate, if we have corporate institutions hearing me, offices, churches, the malls, public places, AED devices are very, very, very important.
Okay. Right. All right. So please join us. We're just about to get into the practical part. Yeah. Doc, please go ahead. So I think I'll be running the commentary from here, so we need to adjust.
So picture this.
So, Doc, I think they need to adjust your mic a little bit so we can hear you much, much better.
It's fine.
On the screen.
Clumsy a little.
Yes.
But then I think.
Please, by now, we're just adjusting her mic.
Baby on the side. So this is baby Natalie. I'll be using baby Natalie for the choking for those who have kids at home. All right. So this is Mr. A. We are in an office, we are having a good time, corporate institution, and suddenly we have a colleague who places the hand on the chest and isn't talking, and then just suddenly collapses. So you, as a colleague in the office, you who finds yourself around, what do you do? So quickly assess for the safety of the environment. Is there anything that may cause potential harm to Mr. A? You clear, and then place the person flat on his back. So the aim is to get a hard surface. And for us, the floor is as good as it can be, right? So just like I said, so this is the practical part. Mr. A, tap on the shoulder, no response. Help, please, help. Jennifer, please, can you help? Ajimai, can you help? Mr. A. Okay. So this is the chest. This is Mr. A's nipple because if it's a female, because of course the nipple can be lower. So you just feel for the chest bone, and then you draw a line, and then the lower part, and then more to the left. This is where it's believed the heart is. All right. So my dominant hand is my right. So I use the heel of my hand, and then I place it, and then my left. So I interlock my non-dominant hand over my dominant hand, and then I place it in the area which is the lower part of the breastbone, more to the left, and then I start my song in my head as motivation, staying alive.
Staying alive.
So please don't flex your arm at the elbow. You keep it as straight as possible. And what I said is push hard and fast. Don't care about breaking any bone. Just keep going as hard and fast as possible. Your aim is to do 100 to 120 in about a minute, but after every 30 compressions, you stop to give a rescue breath if you are alone. So 2 rescue breaths, 30 compressions, 2 mouth to mouth, 2 breaths, 30 compressions, 2 breaths. But if you are with somebody, then you can focus on the compressions and you count out loud. And after 30, the person will give the breath and you reassess and then continue.
Okay.
Right. So staying alive, can we play that song in our heads? Right. So Ajma, you can sing that
We're
song for me.
playing it in
and
our
then we
heads
can
right
go.
now.
Right.
Okay. All right. If you're listening in at home in the office, you can join in and watch how things are going right now.
25, 26, 27, 28, 29, 30. Ajimai, 2 breaths.
2 breaths for my co-host.
Good job.
Okay.
So continue. All right. So I need Ajimai to demonstrate.
So my co-host is
Just go through
taking
the
his
simple
place.
Okay.
Right.
All right. So let's say Jenny has just
Somebody. Somebody.
So I said, Mr. A, Mr. A. Okay. All right.
Yeah.
And then
You call for help.
so Ezekiel, please get me help quickly. Eugene, get me help quickly. Jenny.
Check the pulse.
And then
Is there a pulse? No pulse.
no pause.
Quickly compression. So stand on the side of the patient.
Okay.
Right. So your imaginary line,
Okay.
the lower part of the breastbone.
Mhm.
Here. Your dominant hand is your right.
Okay.
Place your non-dominant over interlock. Let's go. Compressions.
Dog, get closer to the mic as you direct him for me, please. Thank you so much.
Staying
Sorry.
alive. Staying alive. Ah, 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 ah. Staying alive. Staying alive. Ah, 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 ah. Staying alive. Ah, 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 ah. Staying
At
alive.
30.
Yes,
Staying
yes.
alive.
And so
So 30.
I'll do my
2 breaths.
2 breaths.
and
Okay.
Then
then
you continue.
I'll
So
continue.
you keep doing this
Okay.
till you are
Help
either
comes.
tired or help comes.
Okay.
So
Okay.
Ajima will keep doing this till he's tired, and if there's someone around, the person can also take over.
Okay.
So you keep doing this till help arrives.
Okay.
Oh,
Someone
How is
says,
this some exercise this
that's
morning,
some
eh?
exercise.
Doc, you have to take some questions. Someone says, and given the breath, are we supposed to hold their nose?
No.
Please say that into the microphone for us. Eh?
Right. So please, in giving the breath, you are not holding the nose.
You're not holding the
You
nose.
are going to do a thrust of the chin and the jaw just to straighten out the neck.
Okay.
And then you place your mouth over the person's mouth. So you are not holding the person's nose.
Okay.
So you place your mouth. So it's a mouth-to-mouth rescue breath.
Okay.
So you just lift the person's chin, and then you place your mouth over the person. Then just give 2 breaths.
Okay.
Yes. So 30 compressions, 2 breaths.
30 compressions.
2 breaths. Ajimai, that's 1, 2, 3, 30.
2 breaths.
Then he continues with the compressions.
You know, if you don't
That's
remember
all.
anything we said today, please don't forget 30 compressions, 2 breaths.
Right.
Please, can you assess my co-host for me? Scale of 1 to 10.
I think he did a good job.
Please, let's
I
give
think
it up
what
for
I
my...
was looking was for him not to flex his hand, his arm at the elbow.
Okay.
And then the force with weight, because like I said, people hesitate because they are afraid. What if I break the chest?
That's always been my
hard
fear
and
also.
fast.
Okay.
Hard and fast. Your aim is to keep the person alive. So
Alive.
please compress as hard and as fast as you can.
Okay.
Right.
Ajba, I think take your microphone. I'm realizing that I think we've bitten more than we can chew. This requires a lot more time that we've gotten Doc in for. And I think we need to do this like one at a time so it's not all too boxed in for us to follow. So Doc, if you don't mind, can we bring you back? Maybe if you can have this for like a month, where like today, I mean, we've been able to learn what to do in a heart attack. Maybe a week or two after we bring you in and we talk about the choking and all those. So it's easy for us to Ajima, what do you say?
No, I think, Jenny, I mean, we should get time for this. Moms, dads, maybe anybody at all around should, especially when we go on to the young ones as well, the choking and all of that. So yes.
Because there are all these questions here. Someone says, can you address stroke as well? Stroke occurrences. I mean, so I'm going to be saving all these. So we're going to get back to Doc and arrange a schedule where she can come in if it's weekly. And we can all, by the end of 2 or 3 months. I mean, today we're talking about our goals for this. If part of our short-term goals is learn a few first aid skills, I think it will be helpful for all of us. So Doc, please, we're going to consider you say yes. You know, this week we've been playing Annie's, one of our favorite songs. Where we ask you, say Annie. So, Doc, can we have you in again?
Yes, definitely.
Oh.
Because Easter is just around the corner, I won't go into detail with the choking, but can I quickly do something on the adult choking?
Yes.
Because people are going to be partying and then all that. Right? The telltale sign to know if someone is choking is the person clutches the neck. You know, the person clutches the neck. If someone is choking and the person is coughing, is a good sign. Because coughing is actually a reflex which helps to bring whatever foreign objects there is in the throat out. But if the person is not choking, the person cannot make any sound, then that is where you need to intervene. So with the choking, you're at a table and someone suddenly clutches on the neck and the person is choking. What you quickly do is to stand behind the person. If it's an adult, you make a fist. So if it's your dominant hand, my dominant hand is my right hand, you make a fist. And then on the thumb side of your hand, between the person's belly button or the person's navel and then that same breastbone, which is the middle bone, somewhere midway between the two, so just beneath the breastbone, you place that clutched fist in the middle, so the middle of the patient. So draw an imaginary line. So you place your clutched fist over there, then you place the non-dominant hand, and then you thrust it forcefully inward and then outward. So I can demonstrate. So you wrap your arms around the person from the back. You make a fist with your dominant hand. And then the side of the fist, which your thumb is, you place it over the area I showed you. So between the navel and then the lower parts of the bone. And then you place your non-dominant hand and then you thrust forcefully inward and then outward. So I can demonstrate it. So if it's with this mannequin, someone is choking, the person holds onto the neck. This is the navel, and then this is the breastbone. So this is the lower parts where you have the end of the rib cage. This is the lower part. This is the navel. So somewhere in the middle here. So I stand behind the person like I'm hugging the person from behind. I make a fist with my hand, my dominant hand, and then the thumb, the side where you have your thumb, you place it there. Place this over. Then a forceful inward and then upward. So you keep doing that. You keep doing that. Yeah. So what this does, it attempts to dislodge whatever is in the person's throat out. Yeah. So that is the simple thing you do for an adult who is choking. And trust me, this is very life-saving. This is very life-saving. Not to go and pour water on the person, please.
For pour water, I think Doc won't do it again. All of us, whoever did.
Jenny, the water thing, I don't know how it came, but then it's like literally everything.
I think we watch TV those days.
Literally
TV,
everything. You want a bucket of water, and they just dump it on you like that.
Because I remember watching Ghanaian movies, those when somebody collapses, no, you see your first, your breast. So it's like at the back of our
minds. That maneuver is called the Heimlich maneuver. Heimlich, Heimlich maneuver. So simply standing behind the person, wrapping your arms around the person, making a fist between the navel and then the lower part of the breastbone, forceful inward and upward thrust, and it's an attempt to dislodge the foreign object from the person's tooth, and it's very life-saving.
Please, this Easter, if somebody around you experiences this, let's make Doc proud, and you come and say, hey, JJ Diajima, this up, Doc, I did this, we'll celebrate with you. I have Mommy is saying that, yes, we should bring back Doc for an extended time. I agree, because I'm realizing there's so much we can learn.
There are
So
a lot
Doc,
of
we're gonna bring
questions
you
here,
back,
Jenny, so we need
yes.
to do this again.
Yeah.
Somebody's asking what signs we should look out for 10 minutes or so before a heart attack.
And this one too says, yeah, no, Baba deal with Mr.
No,
Achimai.
no,
So
no.
please, let's give it up. My co-host has done very well. Docs, we're going to reach you right after the program.
Right.
Schedule this. We're going to capture all the questions that have come in and pull
right.
them to you, so we can do this.
Definitely.
Doc, God bless you so much. Once again, if you ever heard the story of a doctor who saved a life on a plane, KLM, please, that's the doctor we have in the studio. So if you ever need to have some first aid skills, she's definitely the person to talk to. This morning, we've been joined by Dr. Emefa, Joyce Emefa Addo-Klah. She is a medical doctor and a health advocate. Doc, you'll be seeing Doc a lot more in Sunny. I mean, she loves Sunny. Her son loves Sunny. Anytime we play Stamina, it's because of her son. Like, he's the number one reason why we play
Doc,
Stamina.
is he the one who would usually use Stamina to bait him to eat?
Yes.
Doc, then because we want you now, we play Stamina even more. We play twice a day. Doc, thank you so much for coming
Thank
through.
you for having
And for
me,
all of you
Ajima.
join us
Thank
online,
you.
thank you. Please join us again. We'll be on with Doc, and then she'll be responding to all the questions that you came through with. Please stay with us.